नमामि धन्वन्तरिमादिदेवम् सुरासुरैर्वन्दितपादपद्मम् लोके जरारुग्भयमृत्युनाशम् धातारमीशं विविधौषधीनाम्।
ओम श्री गणेशाय नमः। हरि ओम धन्वन्तरिं नमामि धन्वन्तरिम् आदिदेवं सुरासुरैर्वन्दितपादपद्मं लोके जरारुग्भयमृत्युनाशं दातारमीशं विविधौषधीनां धन्वन्तरिं रमानाथं सर्वरोगनिवारकम् आयुर्वेदप्रवर्तारं वन्दे पीयूषदायकं। सर्वे जनाः सुखिनो भवन्तु। ओम शांति शांति शांतिः। धन्यवाद।
Thank you, Dr. Veena. Now I request all delegates to mute their gadgets. Now Shakuntala ma'am will give brief introduction and motto of raaauos group.
ಎಲ್ರಿಗೂ ನನ್ನ ನಮಸ್ಕಾರಗಳು. ಸೊ ರಾಸ್ ಅಂದ್ರೆ ರುದ್ರ ಅರ್ಬುದ ಆಯುರ್ವೇದ ಅಪ್ರೋಚ್ ಅಂಡರ್ ಒನ್ ಶೆಲ್ಟರ್ ಅಂತ. ಸೊ ಈ ನಾವು ಅರ್ಬುದ ಕಾಯಿಲೆನ ಒಂದು ಭಯಂಕರ ಕಾಯಿಲೆ ಅಂತಾನೆ ನೋಡ್ತೀವಿ. ಅದು ರುದ್ರ ರೂಪ ಇರೋದಕ್ಕೇನೆ ತುಂಬಾ ಜನ ವೈದ್ಯರು ಅದನ್ನ ಟ್ರೀಟ್ ಮಾಡಕ್ಕೆ ಹಿಂದೇಟ್ ಹಾಕ್ತಾರೆ. ಆದ್ರೆ ನಮ್ಮ ಮಧ್ಯದಲ್ಲಿ ಅಂತ ಜನ ತುಂಬಾ ಇದಾರೆ, ನಮ್ಗೆ ಅದು ಗೊತ್ತಾಗ್ತಾ ಇಲ್ಲ ಎಲ್ಲಿದ್ದಾರೆ ಅಂತ ಡಾಕ್ಟರ್ಸ್ ಎಲ್ಲ. ಸೊ ಅವ್ರೆಲ್ಲರನ್ನ ಒಂದು ಪ್ಲಾಟ್ಫಾರ್ಮ್ ಅಲ್ಲಿ ಕರ್ಕೊಂಡ್ ಬರ್ಬೇಕು, ಎಲ್ಲರ ಮಧ್ಯದಲ್ಲಿ ಡಿಸ್ಕಷನ್ ಆಗ್ಬೇಕು. ಆ ಡಿಸ್ಕಷನ್ ಆ ಜ್ಞಾನ ನಮ್ಮೆಲ್ಲರ ಆಯುರ್ವೇದ ಸಾಮಾನ್ಯ ವೈದ್ಯರಿಗೆ ಸಿಗಬೇಕು. ಅದ್ರ ಮುಖಾಂತರ ನಾವು ನಮ್ಮಲ್ಲಿರುವಂತ ಕ್ಯಾನ್ಸರ್ ಪೇಷಂಟ್ಸ್ಗೆ ನಾವು ಆಯುರ್ವೇದ ತಜ್ಞರಿಗೆ ಅಂದ್ರೆ ಕ್ಯಾನ್ಸರ್ ತಜ್ಞರಿಗೆ ನಮ್ಮಲ್ಲಿರುವಂತ ತಜ್ಞರಿಗೆ ರೆಫರ್ ಮಾಡೋ ಮೂಲಕ ಈ ಪ್ಲಾಟ್ಫಾರ್ಮ್ ಒಂದು ವೇದಿಕೆ ಏರ್ಪಾಟ್ ಮಾಡುವ ಒಂದು ಸಣ್ಣ ಪ್ರಯತ್ನವನ್ನು ನಾನು ಮಾಡಿದ್ದೀನಿ. 2019 ಡಿಸೆಂಬರ್ದಲ್ಲಿ ಇದು ಸ್ಟಾರ್ಟ್ ಆಗಿ ಸಣ್ಣ ರೂಪದಲ್ಲಿ ಸ್ಟಾರ್ಟ್ ಆಗಿ ಇದು ಒಂದು 4 ಜನ ಸೇರಿ ನಾವು ಸ್ಟಾರ್ಟ್ ಮಾಡಿದ್ವಿ. ದಿಲೀಪ್ ಸರ್, ನಾನು, ಗೀತಾ ಮತ್ತೆ ದೀಪಾ ಸೇರಿ. ಸೊ ಒಂದು ಬೇಸಿಕ್ ಲೈನು ಒಂದು ಡಿಸ್ಕಷನ್ ಸ್ಟಾರ್ಟ್ ಆಗಿತ್ತು. ಈಗ ಅದಾಗಿ ಒಂದು 65 ಜನ ಈ ನಮ್ದು ರಾಸ್ ಗ್ರೂಪ್ ಅಲ್ಲಿ ನಾವು ಮೆಂಬರ್ಸ್ ಇದೀವಿ. ಇದ್ರ ಜೊತೆಗೆ ಸುಮಾರು ಎಲ್ಲ ಕ್ಯಾನ್ಸರ್ ತಜ್ಞರು ಇಷ್ಟು ದಿನ ನಮ್ಮ ವೇದಿಕೆಯಲ್ಲಿ ಯಾರು ತಮ್ಮ ಜ್ಞಾನವನ್ನು ಶೇರ್ ಮಾಡ್ಕೊಂಡಿದ್ದಾರೆ ಅವ್ರು ಕೂಡ ಈ ಇದ್ರಲ್ಲಿ ನಮ್ಮ ಗ್ರೂಪ್ ಅಲ್ಲಿ ಇದ್ದಾರೆ. ಇದ್ರ ಜೊತೆಗೆ ಸೊ ಇದನ್ನ ಒಂದು 3 ಟೀಮು ಇದ್ರ ಹಿಂದೆ ಕೆಲಸ ಮಾಡ್ತಾ ಇದೆ. ಒಂದು ಸೆಮಿನಾರ್ ಕಂಡಕ್ಟ್ ಮಾಡುವಂತ ಟೀಮು, ಇನ್ನೊಂದು ಡಿಜಿಟಲ್ ಅಪ್ಡೇಟ್ ಮಾಡುವಂತ ಟೀಮು. ಈ ಆಗಿರುವಂತ ಸೆಮಿನಾರ್ಗಳಾಗ್ಬೋದು ಅಥವಾ ರಿಸರ್ಚ್ ಪೇಪರ್ ರಿಲೇಟೆಡ್ ಇದಕ್ಕೆ ಕ್ಯಾನ್ಸರ್ ಸಂಬಂಧಪಟ್ಟಂತ ರಿಸರ್ಚ್ ರಿಲೇಟೆಡ್ ಸಂಬಂಧದ್ದು ಅದು ಆಗ್ಬೋದು, ಅಥವಾ ಕ್ಯಾನ್ಸರ್ ಡಿಸ್ಕಷನ್ ಗೆ ಒಂದು ಡಿಜಿಟಲ್ ಫೇಸ್ಬುಕ್ ಪೇಜ್ ಓಪನ್ ಮಾಡಿದೀವಿ. ಇದ್ರ ಜೊತೆಗೆ ಒಂದು ಸಂಪರ್ಕ ಗ್ರೂಪ್ ಅಂತ ಅಂದ್ರೆ ಡಾಕ್ಟರ್ಸ್ ಅನ್ನ ಕಾಂಟ್ಯಾಕ್ಟ್ ಮಾಡ್ಲಿಕ್ಕೆ ಒಂದು ಗ್ರೂಪ್ ಇದೆ. ಸೊ ಈ ತರ ಒಂದಿಷ್ಟು ಜನ, ಒಂದು 15 ಜನ ಅಡ್ಮಿನ್ಸ್ ಇದ್ರ ಹಿಂದೆ ಕೆಲಸ ಮಾಡ್ತಾ ಇದ್ದಾರೆ. ನಾನು ಅದಕ್ಕೆ ಒಂಚೂರು ಮುಂಚೂಣಿಯಲ್ಲಿ ಇದೀನಿ ಅಷ್ಟೇ. ಎಲ್ರು ಒಟ್ಟಿಗೆ ಕೆಲಸ ಮಾಡ್ತಾ ಇದೀವಿ. ಆ ಧನ್ವಂತರಿ ಆಶೀರ್ವಾದ ಆಗ್ತಾ ಇದೆ. ಎಲ್ರು ಒಬ್ರೊಬ್ರು ನಮ್ಗೆ ತಜ್ಞರು ಸಿಗ್ತಾ ಇದ್ದಾರೆ. ಇದ್ರ ಮೂಲಕ ಒಂದು ವೇದಿಕೆ ಏರ್ಪಟ್ಟು ಮುಂದೆ ಒಂದು ಕ್ಯಾನ್ಸರ್ಗೆ ನಿಜವಾಗಿ ನಮ್ಮಲ್ಲಿ ಕಾನ್ಫಿಡೆನ್ಸ್ ಡೆವಲಪ್ ಆಗ್ಲಿ. ಯಾಕಂದ್ರೆ ಕ್ಯಾನ್ಸರ್ ಅಂದ ತಕ್ಷಣ ಅಯ್ಯೋ ಒಂದು ಕೀಮೋ, ಒಂದು ರೇಡಿಯೇಷನ್ ಸೈಡ್ ಎಫೆಕ್ಟ್ ಕೂಡ ಟ್ರೀಟ್ ಮಾಡಕ್ಕೆ ಭಯ ಪಡ್ತೀವಿ. ಆ ಭಯ ನಮ್ಮಲ್ಲಿ ಹೋಗಿ ಒಂದು ಕಾನ್ಫಿಡೆನ್ಸ್ ಲೆವೆಲ್ ಡೆವಲಪ್ ಆಗಿ ನಮ್ಮಲ್ಲಿ ನಿಜವಾಗ್ಲೂ ಟ್ರೀಟ್ಮೆಂಟ್ ಇದೆ. ಇದು ಎಲ್ರಿಗೂ, ನಮ್ಮ ವೈದ್ಯರಿಗೂ ಗೊತ್ತಾಗ್ಬೇಕು ಮತ್ತೆ ಜನಗೆ ಗೊತ್ತಾಗ್ಬೇಕು. ಇದೇ ಈ ರಾಸದ ಮುಖ್ಯ ಉದ್ದೇಶ. ನಮಸ್ಕಾರ.
Thank you, Dr. Ma'am. Shakuntala ma'am. Now Dr. Divya will introduce today's speaker. Over to you, Dr. Divya.
Thank you, ma'am. Welcome, sir. Dear doctors, let me introduce Dr. Madhav Digavi, sir, to you all. Sir has done his BMS in 1994 from AMV Hubli College with 5 consecutive ranks. And in 98, sir has completed MD from Institute of Teaching and Research in Ayurveda, Jamnagar. Professionally, sir is a professor and HOD of PG Studies, Kaya Chikitsa Coordinator, PG Studies Taranath Government Ayurveda College and Hospital, Bellary. He has around 22 years of teaching experience for both UG and PG and 20 years of clinical experience, and he has treated around 90,000 cases with Shuddha Ayurveda. Also, he has been a PG guide for 13 dissertations, PG co-guide for 9 dissertations, and he is a honorable consultant at Bangalore Panchakarma Center, Bangalore, and Vatsala Healthcare Center, Bellary. He is an expert in KC, Panchakarma, Rasayana, Vajikarana, Manas Roga, thyroid, and spine disorders. Other milestones Sir has reached are about paper presentations. He has presented around 3 international papers, 10 national papers, 30 state papers, and has come out with 10 publications, 5 radio talks, and 5 TV programs. He has been in more than 150 seminars as guest lecturer and has been a chairperson in 4 conferences and a keynote addressee in 5 conferences. Sir's state research project has been on management of anemia with Dhatri Loha, and he has worked under Vaidya Shrikant Bhagewardikar, Sholapur, on cancer and multi-organ failure. Sir is also founder of Madhava Forum, which is an advanced school of Ayurveda and PG entrance training center. Regards to his other professional details, Sir has been a former member of CCIM Syllabus Committee, CCIM Visitor, New Delhi, and ex-BOS member RGUHS, peer reviewer of IU International Journal, examiner for RGUHS Bangalore, GAU Jamnagar, Amrita School of Ayurveda Kollam. He has organized ROTP National State Conference and CME workshops, RGUHS study material workshop as per CCIM syllabus of BMS. Sir, we take the honor and to welcome you for our seminar, sir. Thank you for joining us.
Thank you.
Over to you, Geeta ma'am.
Thank you, Dr. Divya. Now I request Dr. Madhav Digave sir to start today's session. Over to you, sir.
Okay, my PPT is visible?
Yes, sir. Yes, sir.
Okay. रागादि रोगान् सततानुशक्तान् अशेषकाय प्रसृतान् अशेषान् औत्सुक्य मोहारतिदान् जघाना यो पूर्व वैद्याय नमोस्तु तस्मै. With great salutes to Lord Dhanvantari and legendaries of Ayurveda, Maharshi Charaka, Sushrita and Vagbeta, all my teachers, my dear friends, and a big group of practitioners from Bangalore, Rudra Association, very enthusiastic practitioners taking much interest in exchange of thoughts. And, Shakuntala Madam, Geeta ji,
Thank you, sir.
all the members of RAAauos, and my best friend Dr. Suresh Vyavahare, Dr. Dilip, and all my friends. I thought of speaking on cancer, and there is no A to Z of cancer which can be covered in 1 hour of discussion. But I thought of giving some series of information on, as Dr. Shakuntala was rightly telling, we should build confidence in our own self that we can treat cancer-like cases. So our students or practitioners should have some confidence in this. We should have some special personality to work in cancer sector. As we know, cancer is a big disease, no doubt. But the people who are in the front of cancer management, they have made more complexities. And also they have made very costly affair of cancer treatment. It is a big industry, cancer industry is very big. So people will be afraid of starting their career in cancer. So my focus today is on to build a cancer and Ayurveda as one of the personality development and the self-confidence development program for beginners in cancer, so that they can start understanding what Ayurveda says about cancer. Can we really start cancer management? Because the question of cancer will be always in a duality. There will be dualism, there will be confusion, there will be fear. When I gave this research topic to my PG scholar, Dr. Nazat is working on this. She was having a lot of questions, lot of fear, but she was a bold and daring girl. She started treating cancer patients, and now she is mastering this. Just within 2 years, a PG scholar can become a master in treating cancer patients. Why not the practitioner who are already in the market for 10 years, 5 years, 6 years? With this question, I started preparing my talk for today, so that it will be a basic thing. It is not going to tell directly what is the formula for this cancer, formula for that cancer, but we should understand some basic platform, so that doctor will have a positive confidence. Then they can easily understand the concept of a patient's issues in cancer, and they can give solution. Ayurveda starts about talking about Arbuda as a disease where we get some cancer issues. Arbuda is nothing but a swelling in the body part due to the dosha dushti. And Arbuda word is used by Acharya Sushruta for those growths which are born out of Mamsa Dhatu. So the cancer in Ayurveda, and as per Acharya Sushruta, Arbuda is the basic terminology to understand cancer, where it is born out of Mamsa. And it is due to the Sannipataja 3 doshas. It is a fixed mass, painful mass, and also it is having a progressive in nature. It is a broad-based growth. It is a broad-based tumor. And it is not having suppurative swelling. Normally, whenever there is a swelling or a growth in the body part, it will be having suppuration, where pus will be located in that. But cancer tumors are not like that. They are bigger in size, they are broad-based, they are fixed, they are painful, and they are slowly growing. If this is the character of any patient presenting to you, try to diagnose it as Arbuda. Then its roots are very deeply seated. So Mamsa Medo Dushti is a very important principle to understand in cancer management. One is Mamsa Dushti and Medo Dushti. Another is Tridosha Sannipata Dushti. If you don't understand these issues, you will be always doubting whether Tamravasma is going to cure, whether Nagabhasma is going to cure, what should I give, whether I should combine 2 Bhasmas, whether I should give only Kashtaushadis. Patient may not take Rasaushadi, they may have cancer-induced or my drug-induced kidney failure. So many doubts will start. So, whatever modern people talk about cancer, don't worry. You try to assess 3 doshas and dushti lakshanas, and then Mamsa dushti lakshanas and Medo dushti lakshanas. So Acharya Sushruta rightly quotes here, Gatra Pradeshe Kvajiteva doshaha Sammurchita Mamsam Abhipradosha Vrittam Sthiram Mandarujam Mahantam Analpamulam Chiravruddhi Vyapakam Kurvanti Mamsopachayantu Shofam Tamarbudam Shastra Vido Vadanti. Acharya Sushruta also says, Arbuda Shastravit is a new terminology. Shakuntala Madam and Gita ji can use this word, a very good word from Acharya Sushruta. Arbuda Shastravit. So this oncology is talked about by Acharya Sushruta, that it is Arbuda Shastravit Vadanti. The expert in Arbuda Shastra, the experts in oncology of Ayurveda, the experts who are treating tumors will tell like this. There is a Mamsa Upachayam. Mamsa Dhatu is complexly rotated and rounded so that a tumor is seen on the body parts. It is dosha sammurchita lakshana. We should understand purely in Ayurveda rounds, whenever you get a tumor patient, so you should understand that this is dosha sammurchana. So in Rasa Chikitsa, when we prepare Rasaushadis, Murchana is one samskara for Parada. Here, Parada Murchana is not going on. Here, Dosha Sammurchana is going on. Sammurchana is Sampurne. It is a total conversion of doshas in Murchita Avastha. Doshas are Murchita in a particular site. It may be a bone, it may be a muscle, it may be a ligament, or it may be uterus, or it may be breast. Wherever dosha sammurchana takes place, there mamsam avipradusha. The tumor signs starts with doshas which cannot be seen, and later on tumor signs ends with mamsam. So there is a latent conversion of doshas, and sammurchita doshas will land up in mamsa pradushana. Then mamsa upachayam takes place. That mamsa upachaya is not normal upachaya. This mamsa upachaya is a cancer metabolism of the local tissue or a spreaded tissue, and due to that a shofa is manifested. Mamsa upachayam shofam dosha sammurchitam mamsam medam abhipradushya kurvanti vruttani Sthirani, Mandarujani, Mahantam, Analpamulam, Chiravruddhi Apakam. You please, doctors, give this attention to this. This tumor is Apakam. Actually, don't get confused with that. Whenever there is a swelling, it will have 4 phases. Like there is a temperature, there is a swelling, and then it becomes red in color. They are all inflammatory changes. But in cancer, it is chiravruddhihi apakam. It will not get pakam. So any cancer patient comes to you with a growth or a tumor, then in that neoplasm, you must understand the nature of the samprapti of cancer patient as apakam. It will not get pakam. If it gets pakam, the tissues will collapse and the body will remove it by immunity. But here, this is a culprit. Dosha sammurchita and mamsa upachita shofa is a culprit that it will not undergo metabolism. Just like every cell undergoes metabolism, this cancer cell will not undergo metabolism. Then you choose a solution. See, here only you can understand definition as well as treatment perspective. You give treatment for a apaki shofam. Right? Apaki shopam. It is not getting converted or metabolized or metamorphosed, and that apaki shofam should be treated as cancer. A pakavan shofam can be treated by shalya karmas or lepa karmas or lepa chikitsas, but apaki shofam, a shofa which will not undergo suppuration, which will not undergo any pus formation, there actually cancer concept has to be taken. When apaki shota is there, we should give only shotahara drug, like Trifala Gugulu is shotahara, but it is not for apakam, shofam, mamsa upachayam arbudam. So you should think beyond that. So what you can think is Trifala Kajjali is one of the best choice you can understand. Prepare Trifala Gugulu by adding Kajjali into that. This Kajjali will be Triguna Kajjali. If you use Triguna Kajjali and prepare Trifala Gugulu, then that will act on Apakam, Mamsa, Upachayam, Shofam, Arbudam. So this is the basic understanding of Arbuda as per Acharya Sushruta. Later on, starting treatment for that. Your own simple drug may be effective, like Kankayanavati. When Kankayanavati we are giving, we give for any swelling, we give for any tumor. But if you are able to give a certain modification upon Kankayanavati, you give Varnadi Kashayam, Bhavana on Kankayanavati, or Kankayana Anupana as Varanadi Kashayam, then this Apaki Shotam will be decreased. Varanadi Kashaya, in that the first drug Varuna is definitely a drug for Shofam. And Varna is an anti-inflammatory, and Varnadi Gana is Kafameda Haram. It is basically Kafameda Haram. So here you are seeing Mamsa Meda as doshas and Kafa Pradhana three doshas are there. Then Kankainavati Trifla Gugulu, which is additionally added with Kajjali, Trigunakya Kajjali, then that will give you result in this. And one more very good approach is Bahi Parimarjana Chikitsa. If you are able to use the Dashanga Lepa or Shotagna Lepam or Jatamayadi Lepam, Pattam Chukkadi Lepam, they are all Shotahara. But if you want to make Chiravruddhi Apaki Shotahara, you should use the Gomaya Rasa and Gomutra as media for preparing the Lepa. You take Jatamayadi Lepa or Shotagna Lepa and mix it with Gomaya Rasam and Gomutram and heat and prepare a lepa. If you apply this lepa, this Chiravruddhi Apaki or Mahanta Moolam Manalpam Shofam, Mamsopachayam and Mamsam Avipradusha Jo Shofam is there, that Tam Arbudam can be dissolved by this. Gomaya and Gomutra have got potent anti-cancer action. So Go Rasa plus Gomutra, when you are using such drugs for using lepa karmas, they will have anti-tumor activity. What else you want? You can use even Kanchanara Rasam. If you use Kanchanara Tvak Rasam, that is Kanchanara Kashayam, and use Shotagul Lepam for application over the tumor, application over the Arbuda, definitely there will be a regression. Even application of Panchagavyas, if you collect all the Panchagavya, but provided that Panchagavya should be collected from a cow which is having natural feeding, which is not eating any plastic, which is not eating any paper. There should be a cow which is properly given nutrition. And if you see the cow dung, its smell is very bad because cow eats anything whichever is in its front. That cow dung will not be having anti-cancer property. If we give Mashaparana Pravrutis feeding to the cow, if we give Kanchanara Patra for cow, if we give Kadali Patra for cow, that cow which is fed with these Ayurvedic plants will have no smell in the Gorasa. And that is powerful Gorasa and Gomutra. In that Gomutra, lot of chemicals are there which will dissolve the tumor. And heat this Jatamayadi Lepa or Kottam Chukkadi Lepam by adding Gorasam and Gomutram. And if you do an external Lepa Karma, definitely there will be reduction in the size of the tumor. We have seen from lipoma to sarcoma, the people will respond with only Bahiparimarjana Lepa Upakram. Then if you go to the systemic Shodhana followed by Rasayana Chikitsa, definitely there is a scope for treating in cancer. If you are a beginner, you will get 4 or 5 terminologies like a cancer, commonly used word. Neoplasm is another term used in oncology. Tumor is another term used in oncology. Sometimes doctors use carcinoma as a word, a term for cancer, sometimes malignancy. See, when patient comes in your clinic, if you tell you have cancer, patient will get collapse because cancer word is understood by the patient as a deadly disease. So doctors will write as, this is a neoplasm, don't worry. This is a tumor, I'll do surgery. This is a carcinoma type of issue, I'll do this. Somebody says it is malignancy, don't worry, I'll treat. Patient will not understand that it is not cancer, something else. So patient will survive. So for our communication purpose, cancer word is used, neoplasm word is used, tumor word is used, carcinoma word is used, malignancy word is used. Cancer is a growth. It is having excessive proliferation of cells without apparent relation to physiological demands of organs involved. See, what is this cancer? it is a excessive proliferation of cells. Normally, proliferation of cells takes place in our body. Shirate anena iti shariram. So, whenever cells are dying in excess quantity, then it is called that aggregation of proliferated uncontrolled cell growth is called cancer. Neoplasm is abnormal mass. It is a mass. It is Prithvi Mahabhutamardana, an abnormal mass of tissue that forms when cells grow and divide more than they should or more than the need they die. When it happens, neoplasm may be called, neoplasm may be benign or malignant. This huge growth mass may be a benign growth or malignant growth. What is benign growth? Benign growth means it is non-cancerous growth. Malignant growth is cancerous growth. The tumor word or mass are both used similarly. It is a lesion, simply a growth or enlargement which may be neoplastic, like granuloma. Whenever you get a term in modern medicine as oma, granuloma, astrocytoma, glioma, meningioma, schwannoma, myoma, this oma, when it comes in the end of a term, that oma is related to a tumor or cancer. So, whenever a parthiva guna increases in the body in one particular ekasthana, then that parthiva amsha vriddhi can be called tumor. Carcinoma, see here also oma is there at the end of the word. It is used in National Cancer Institute. They tell that cancer that begins in the skin or in the tissues that line or cover the internal organs is called carcinoma. When we should use word carcinoma? Whenever skin is having tumors, whenever skin is having cancers, we should use the word carcinoma. Or some tissues that line or cover the internal organ. For example, there is a meninges covering the brain. If meninges get a cancer, then we should use the word carcinoma of meninges or meningioma. Understand? Malignancy is a term. It is a disease in which abnormal cells divide without control and can cause or invade the nearby tissues. This is a particular dhatu is there in the body, like we have mamsa dhatu in the body. If inside the mamsa dhatu, if some abnormally divided cells, halfly matured cells, randomly enter in them, randomly pass through the tissue, and they start making a tumor or growth, then we use the word malignancy. Are you following? This is dhatugata doshas, dhatugata dushyas. Inside a dhatu, malarupi, vatapitta kapha and other tumor factors will enter, then we call the word as malignancy. Malignant cells can also spread to the other parts of the body through blood and lymph system. You remember, whenever you are handling a cancer patient, two important spreading methods are there. One is by lymphatic system, another is by hemopoietic system. So blood and lymph are important tissues, are important liquid tissues which will help in distant metastasis, distant spread of cancer. Then what is metastasis? As you all know, metastasis is the spread of the cancer from its origin state and it goes to the distant cell or tissue, and there it will reside for a certain period of time. Later on, cancer will develop there. Then we call it as metastasis. Metastasis, short form is METS, METS, METS. So, as a Ayurvedic doctor, Ayurvedic practitioner, if you remember these 5 terms, you can really address to the patient's problem. You can also convince the patient or patient attenders, or if any report comes with cancer, neoplasm, tumor, carcinoma, malignancy, then you will understand these are all one and other arbuda and cancer. See, Ayurvedic doctors will be bored about knowing Ayurvedic people are writing synonyms. For every plant, there are 10, 20 synonyms. For every Ayurvedic term, there are synonyms. So what is the use of synonyms in medical practice? See, allopathy people are also having 5 synonyms for one disease. These are all synonyms, but they use according to their some planning. When to use the word cancer, it is for layman's word. When to use neoplasm, when to use tumor, when to use the word carcinoma, when to use the word malignancy. So these are all, I thought it is very essential for practitioners to know these terminologies. And if you are academically interested, what is the prevalence rate of cancer, incidence rate of the cancer? 94 people among 1 lakh males and 104 females among 1 lakh females get cancer. This is as per National Cancer Registry 2021. See, 94 male patient will involve cancer pathology out of 1 lakh people, whereas female 104 females will get cancer in 1 lakh female group. So females getting chance of cancer in 1 lakh is more than male patients. So female patients have more chances of getting cancer. Lung cancer is very common in males. Breast cancer is very common in female. See, the site is Uttar Pradesh. See, Ayurvedic understanding of modern literature is, you can understand, CA lung is very common in males and CA breast is very common in female. So, lung and breast both are in Kafasthana, both are in Urasthana. So, Kafasthane Arbudam is very common in male and female. So, you have to give line of treatment Ayurveda is Kafasthane Kafavruddhihi, Kafasthane Kafapradana Tridosha Vruddhihi, Kafapradane Mamsa Vruddhihi, Meda Vruddhihi, Kafasthane Gulmam. If you understand like this, you are able to understand which is the Sthanika dosha and which is the Agantata dosha. In a tumor biopsy, you can read which type of cells and which type of tissue is affected with cancer. Then you start Ayurvedic thinking. A basic fundamental approach to cancer is CA breast and CA lungs are in Kafasthana. Kafasthana is Kledaka Kafa, Avalambaka Kafasthana. And in Avalambaka Kafasthana, Mamsa Dushti, Meda Dushti takes place, Tridosha Dushti takes place, and tumor manifestation starts. So, Yatkinchit Kafagnam, Yatkinchit Mamsaharam, Yatkinchit Shotaharam, and anti-cancer. Taxus baccata is a plant which acts like this. And if you are able to understand, the drugs like Mahamanjishtadi Kashayam, it acts on Rakta. So one step behind Mamsa. And Shilajatu Rasayana like Shiva Gutika. BV Pandit Pharmacy prepares a very good Shiva Gutika. I'm not advertising them. You can also try. Gugula Tiktakam Kashayam and Shiva Gutika, a Shilajitu Rasayana. If you give it, then they are Kafasthane Kafadoshaharam, Kafasthane Mamsa, Meda, Kafa, Amadosha Nashanam, and anti-cancer. Estimadu Churna is also single drug anti-cancer. Acharya Charaka says, Medya Visheshena to Shankapushpi, but Kshirena Estimadukasya cha. The drug should be used for Kafachedanam, Kafasthane Kafachedanam, Kafasthane Mamsaharam, Doshaharam, Kafasthane Meda Doshaharam. For that, you can give 12 grams of Estimadu Churna mixed with Kshira, Gokshira, morning before breakfast, night before dinner for 48 days. You can see the changes in a patient of cancer or tumor. The reason is very simple. Estimadu is used as a Kantya Aushadhi, Kasahara Shvasahara Aushadhi, but naturally it is not so. If you read the properties of Estimadu, it is Rana Ropanam, it is Shotaharam, Medyam, and it is Dhatu Vardhanam. Estimadu contains phytosteroids, which are powerful anti-inflammatory drugs. And if you give Estimadu with Kshira, many patients of Kafasthane, Kafavruddhihi, Mamsavruddhihi, Medavruddhihi, Vranam, Shotam, Shofam, and ulcers, they can be treated. 1 in 9 Indians will develop cancer in their lifetime. Out of 9 people in India, 1 may get cancer. So this is the prevalence rate of cancer. And if you read the history of cancer, it is very interesting why this mark is used for cancer hospitals, cancer doctors use this symbol as a cancer marker. In 2000 BC, Egyptians mentioned both benign and malignant tumors as per the literature of modern science. But before 2000 BC, in 5000 to 6000 BC, Ayurveda was noting about arbuda and cancer. So the castor oil, pig's ear, and other animal parts for treatment of cancer in those days. Castor oil, it is having a powerful vatahara, vatakafahara effect. And cancer is, if it is born out of vata and vatakafa, then payasa erenda taila. Erenda taila is one of the shodhana drug. You should not use refined castor oil. You should use crude castor oil from the mill and give murchana samskara for erenda taila. That murchita erenda taila is very, very effective in case of kafasthane kafavruddhihi, kafasthane mamsavruddhihi, kafasthane tridoshavruddhihi. So almost 1500 years ago, Hippocrates gave the name carcinos or carcinoma to a group of disease, and he said, including cancers of the breast, uterus, and stomach and skin, they're all involved in this logo. So, resemblance of cancer to a crab. Crab is a bunch of veins over the surface. If you can naturally see a crab, it has got bunch of veins over the surface. So carcinoma is also born out of the Indian crab. They saw the crab, they saw the frog, and by seeing the frog arrangements and crab arrangement, crab was taken as symbol of cancer. Although Galen removed some tumors significantly by surgery, but still he believed that cancer should be best left untreated. Don't do surgery, chemo, radio, or any Rakshasi Chikitsa for cancer patients. Rather than doing Rakshasi Chikitsa, you can leave them like that. If you focus the understanding Arbuda, see in this esophagus, there is a growth, there is a tumor. So how to understand this word Arbuda is Arb and Udeti are two words in Arbuda. Arb is to kill or to hurt or to go towards, and meaning of the verb is Udeti is to elevate or to rise or throw up. So when tumor starts in the skin, when tumor starts in esophagus, it will not stop. It will keep on growing. Though keep on growing without undergoing paka is the nature of cancer cell, whereas normal cells will never undergo continuous similar structure, and they don't have uncontrolled production. In Sanskrit English dictionary, if you read the word Arbuda, its meaning are very multiple. Arbuda is a swelling, Arbuda is a disease process, Arbuda is a tumor, Arbuda is a polyps. In large intestine, there are polyps, that is also Arbuda. A serpent, Arbuda means the word serpent. It is like a snake, will destroy your life. It also means cloud. A round, long mass is also called Arbuda. Mountain is also name of Arbuda. Name of the hell is Arbuda. In Ravana Samhita, the word cancer can be denoted numerically as 10 crores. That many numericals are there in cancer. It can be taken for abnormal cell division and in cancer due to the Vata. See, normal cell division is Vata. Bais Tantra Yantradaraha Karta Garbhakriti Nam. is Vatasya Karma in Charaka Sutra Sthana, 12th chapter, Patakala Kaliya Adhyaya. In cancer, what happens is the cell division is uncontrolled. Cell division will not stop. See, whenever you have a bleeding, if bleeding stops, it is normal. If bleeding doesn't stop at all for 1 month, 2 months, or 3 months, and then we can think that because it is not stopping, by number, then we call that uncontrolled bleeding due to the Nija Karanas as cancer. Okay. When Shirete Anena Shariram word is there in our Ayurveda, when some amount of cells die every day, that much amount of cells will be replaced by human body, by reticuloendothelial system, somatic cells and bone marrow cells. All these will try to develop how many cells die in one day, that many cells will be recovered. If this balance is going on, it is health. If this balance is disrupted, then number of cell death per day is more than number of cell replenished or rebuilt by the body is less. So you have more cell destruction and less cell formation. This imbalance is called cancer. So what you have to do is you should do correction of cell division. See, Ayurveda can do a lot of role in this. People think that what is there in Ayurveda, how Ayurveda can treat cancer, what is research in Ayurveda for cancer. There are so many questions. But my dear friends, the nanoparticles of any metal, like silver nanoparticle, gold nanoparticle, or lead nanoparticle, any metal, if it is convertible into the nanoparticle, nanoparticle is a supercharged molecule which can heal the cancer process. Cancer word is derived from the Greek kapkiwok, which means crab and tumor. A Greek physician called Hippocrates and Galen noted similarities to crab and tumors with swollen veins. So they could see that a swollen tumor with swollen veins look like a crab. So Hippocrates and Galen used the word captiva as cancer. In the Latin, carcinos is the word used, which means crab and recommended surgery as treatment. A crab-like growth or crab cutting like of pain is there, then it is called carcinos. Neoplasm word is derived from crescimento neo, which means it is a new growth. Neoplasm is new growth. Onkos is derived from Greek oikos, which means burden or volume or a mass. See, whenever there is a parthivaamsha vriddhi in a particular anga, then we call it as oncogenesis or oncology. Okay. What are the predisposing factors for getting a cancer? See, every practitioner must know this. There is a familial tendency of cancer and genetic factors for cancer. So, Mata Pitroho Bija Doshat is one of the cause for development of cancer. A normal cell is converted into cancer cell because of Bija Dushti, Bija Janaka Bija Bhaga Dushti, Bija Janaka Bija Bhagavayava Dushti. Dushti of a chromosome, dushti of genes, or dushti of DNAs. In the double helix DNA, there is AGTT sequence is there. If that sequence is distorted by viral infection, then normal cell is converted into cancer cell. So what we have to do is use of Amalaki Rasayana told in Charaka Samhita, Rasayana Pada. They all have capacity to stop genetic factor influencing cell division and causing cancer. Racial and geographic. Based on Desha, Ayurveda talks about this. A particular area people get more cancer. For example, metro people get more cancer. This is based on the geographic distribution. Environmental and cultural factors are also predisposing cancer. If environment is, for example, in the pandemic season, environment is polluted. Due to the automobile vehicles, environment is polluted. These polluted environment will cause cancer growth. And industrial and environmental substances like asbestos, lead, copper, zinc, which are used in the industry and they are thrown out into the river, and these pollutants will cause cancer. Why cancer comes? It is by long-term itching, long-term friction, and long-term inflammation, long-term cell division damage will cause cancer. So for everything there is a specific drug. If there is an environmental influence for a predisposing factor, then you change your environmental system, ecobiological system. How can you change your environment? Change environmental improvements by plantation of different plants. Colorful flower plants, colorful plants are very tall plants. If you do implantation, they will change the environmental factor. Then physical carcinogenesis due to the radiation, trauma and irritation. If there is a continuous irritation on the skin, continuous irritation on an organ, continuous irritation of your mind will cause cancer. So if you have trauma, accident, radiation, X-rays, gamma rays, UV rays, if these rays are going to touch your body, then they will cause cancer manifestation. At the same time, so physical irritation, skin irritation, gum irritation, or blood vessel irritation, tissue irritation, or even mental irritation can cause cancer. So try to counsel your patients, dear doctors. You counsel all these things in their cancer management. And then low fiber diet and high cholesterol diet is said to cause cancer. Dear practitioners, please go through this. Taking normal fiber is good for health. Taking excessive fiber or taking low fiber diet or taking cholesterol rich food will cause cancer. Who is not eating cholesterol rich food now? Every child or every adult will take um, chips, kurkure, lays, oil fried food, chaats, bakery products, samosas, all these chatpata oil food is going to cause cancer. And another report says, Ayurveda also says, Thailam Vishaktam. If you use more thaila in your food, it is toxic to the body. Excessive consumption of thaila will cause pitta vriddhi, and from there it will cause cancer manifestation. And then viral carcinogenesis is a condition due to any viral infection, mutation changes or cell division changes in the body. So that's why COVID-19 in coming 10 to 20 years, post-COVID cancer manifestation is high risk group of practice. Patient has not done any mithya vihara due to the environmental issues. If person has suffered with a viral infection, there are so many viruses responsible for causing viral infection. Patient will take antibiotics, but that is wrong. For viral infection, taking antibiotics is wrong because unnecessary antibiotics will suppress the immunity and patient will develop post-viral infection cancers. Chronic non-neoplastic or pre-malignant conditions are there, and pre-malignant conditions, if they get suitable environment, they will convert into malignant stage. Hormones and cancer. Some of the hormones are there, steroid hormones. If they are secreted in high dose, patient will develop modification of carcinogenesis. Sex, male patients will get more of particular cancers. Female patients will get more of particular cancer. And age group, as per the age, old age people have more chance of getting cancer. So if you come to Ayurvedic Nidanas, we have a lot of Nidanas which will cause cancer. So any Samanya Hetu, Mamsa Pradoshaja Hetus, Mamsava Sruto Dushtikara Hetus are all going to cause cancer. Abhishandi Bhojanam and Thula Bhojanam, that is eating heavily. If you eat more food, it is going to cause cancer. If you're going to eat a heavy amount of food, it is going to cause cancer. Guru Bhojanam, Guru Gunayukta Ahara will also cause cancer. Bhuktancha Swapatam Diva. See, sleeping immediately after lunch is going to cause cancer. So don't sleep in the afternoon. Diva Swapnam will not cause today. If you sleep today afternoon, tomorrow you will not get cancer. But doing this lifestyle, sleeping in the afternoon for a long time will cause cancer. If you understand Samprakti Chakra, due to the Nidanas, Vata Kapha Pradhana, Tridosha Dushti takes place. So in Ayurvedic treatment, Vata Kapha Pradhana, Tridosha Hara Chikitsa, like Vamana, Virechana, and Basti and Nasya, if you follow these four Shodhana Upakramas, cancer can be treated. Or before onset of cancer, if you undergo Vata Kapha Shodhanam and Vata Kapha Pradhana Tridosha Shamanam, cancer genes can be blocked. For example, in some of the family, cancer is very common. So for the next generation, regularly give Vata Kapha Pradhana Tridosha Shamana by Vamana, Virechana, Basti and Nasya. If you practice every year, their carcinogenic gene will not open. For every cancer, there is a gene responsible for that. Organ specific gene is responsible. So that's why we should do Sarvadahika Shodhana, Panchakarma Shodhana. Then we can arrest this Vata Kapha Pradhana Tridosha Dushti. And Agnimandya and Ama Utpatti. Normally, everybody gets Agnimandya, everybody gets Ama Pravrutti, Ama Utpatti in day-to-day life. But if this Agnimandya and Ama Pradosha runs for a long time, then normal cell is converted into cancer cell. So normal cell can be given with Shodhana and Rasayana Chikitsa, then it will not try to convert from Agnimandya to cancer. CA stomach, CA liver, CA gallbladder are very common in Annavasrotas. It is because of Samshodhanam Akurvatam. If you are not undergoing Rutu Samshodhana and Rutu Rasayana, what is Rutu Samshodhana? In Varsha Rutu Basti Karma, in Vasant Rutu Vasantika Vamana, and in Sharad Rutu Virechana. If you do these three course of Panchakarma every year from your adulthood to old age, then your cancer gene will not open. Okay. Next is vitiated doshas get into different sthanas where there is Kavaigunya. See, if there is Kavaigunya, their cancer will get more attracted. If your tissue is not having Kavaigunya, then your chance of getting cancer is very rare. So cancer prevention can be done by identifying Kavaigunya. And if you identify Kavaigunya and give Vata Kapha Pradhana Tridosha Hara Rasayanas and Panchakarma Chikitsas, then you can definitely prevent these cancer manifestations. Kavaigunya is Upitanam Midoshanam Sharire Paridavatam Yatra Sangaha Kavaigunyat Vyadis Tatropajayate. Where there is Kavaigunya, their Sangha will take place and their Samprapti of cancer will develop. So Arbuda is manifested and then it will have Shatkriya Kalas. Sanchaya, Prakopa, Prasara, Sthana Samshaya, Vyakti and Veda. All 6 stages are there in cancer. If you want to understand, when there is a successful DNA repair is there, DNA damage will be converted into normal cell. If DNA repair is not possible, then any inherited mutation will start happening. So genes will affect the DNA and the genes will affect the cell growth and apoptosis. Then due to that, there will be a mutation of the genome of somatic cell. Either activation of growth promoting carcinogen will develop or inactivation of tumor suppressor genes will take place or alterations in genes that regulate apoptosis will take place. So what is Pratama Dosha Dushti in oncology is due to the DNA repair issue. Every cell has got a DNA. If the DNA is not repaired by Ahara and Aushada and Nitya Rasayana and Naimitika Rasayanas, so that's why daily Amalaki Rasayana, if you take DNA cell repair will be very good. If you take daily Trifala Churna, DNA repair takes place very commonly. If you don't do that, either activation of growth promoting oncogenes or inactivation of tumor suppressor genes or alteration in the gene that regulates apoptosis takes place. Due to any of these 3 events, unregulated cell division, cell proliferation starts and decreased apoptosis. Apoptosis is a method by which the dead cells are removed out from the body. If that process is hampered, only production of the cell maturation, cell division takes place, but they are not released out of the body, then they will develop a definite clonal expansion. Due to that clonal expansion, angiogenesis takes place, or they escape from the immunity, and due to the immunity loss, additional malunion of some of the chemicals takes place, and tumor progression starts, malignant neoplasm develops, invasion into the different tissue starts. So cancer utpatti, cancer moving into healthy tissue, cancer eating the normal food of the healthy cell and releasing the endocrine toxins. By this actually cancer patient dies. Don't cut the cancer tumor all of a sudden without any plan. If you abruptly cut and excise the tumor, there will be again cell division increasing, and regrowth of cancer and metastasis is very high risk. So, like this, cancer is manifested. How cancer will spread? It can spread directly from one tissue to another tissue. It is called local spread or direct spread. It is called invasion and metastasis. Invasion by lymphatics. Normally, by lymphatic system, cancer spreads from one place to another place, one organ to another organ. So, if you give Medohara Vidangadi Loha or Vidangadi Loha Kalpas, Tapyadi Loha, this invasion by lymph node will stop. For that, you can give Trifala Rasayanam, and you can give Vidangadi Loha Rasayanam, or you can give Abhayamalaki Rasayanam, or you can give Bhallataka Rasayanam. If you give these Rasayanas, the spread through lymphatic will stop. Even spread can happen by blood vessels. In that case, you can give Manjishtadi Yoga. Very simple is Mahamanjishtadi Kashayam. It will stop spreading by blood vessels. Shonitamrutam Kashayam is there from Kerala pharmacies. That is also going to arrest blood-based spreading of cancer tissue. Natural passages in any srotas, cancer can spread. And then by inoculation, when BCG inoculation is given, antiviral inoculations are given, there is a chance of spread of cancer. You can see in the picture CT scan of a boy having a tumor in the eyeball, tumor in the head. I have seen that these tumors in the head, Asti Vruddhi Lakshana, like growth is there in this picture. I have got a patient treated since more than 4.5 years. Only Trifala Guggulu, Nityananda Rasa, Kankayanavati, Varnadi Kashaya has stopped the further progress of this tumor. So this bone tumor can be stopped by using Shilajitu Vatakam or Shiva Gutika also. Single drug Shiva Gutika and Ballataka Gruti will also help to regress the tumor size. You see in a lower picture, a lady is having, in the neck there is a huge tumor is there, where veins are visible. This is also a very good case for surgical excision of tumor. If patient is able to tolerate, he can do this. Otherwise, we can treat Ayurvedic line of treatment. This neck is a Kafasthana. In Kafasthane, Kafavata Pradhana Tridosha Dushti is there, and Mamsa Meda Pradoshana is there. Once again, Kajjali Yukta Trifala Guggulu and Varnadi Kashayam, Shilajitu Rasayanam have got a definite role to play. In the same way, Tamra Bhasma is having very good Lekana Karma, Shotahara Karma, Tridoshahara Karma, Pitta Pradhana Tridoshahara Karma. In such case, Ashoka Grutam, Ashoka Churnam, Ashoka Ganavati can be given, and this also is going to decline the swelling. Another drug we can get is Dashamulam. Dashamulam is Kafaharam, Kafavataharam, Vatanulomanam, Shotaharam, Shodaharam. So this Dashamula Kashayam, various forms of Dashamula Kashaya are there. Dashamula Katatrayadi Kashayam is good for lung cancer. Dashamula Kashayam is very common drug for first stage of spread of cancer. If you come to the classification of cancer, Ayurveda classifies as Vataja Arbuda, Pittaja Arbuda, Kafaja Arbuda, Mamsaja Arbuda, Medaja Arbuda, Raktaja Arbuda, Stana Arbuja, and Sannipataja Arbuda. Like this, all Charaka Sushruta, Vagbata, Madhavanidana, Sharangara Samhita, Yogaratnakara, Bela Samhita, Harita Samhita, they have covered these types of Ayurvedic classification of cancers. If you can see, epithelial tumors are there, right? In that, squamous epithelium tumor, transitional epithelium tumor, glandular epithelium tumor, basal cell layers of the skin tumor, neuroectodermal cancers, hepatocytes cancers, pancreatic cancer. So these are all epithelial tumors. These epithelial tumors are very common with squamous cell papilloma or squamous cell carcinoma, transitional cell papilloma or transitional cell carcinoma, adenoma, adenocarcinoma, basal cell carcinoma, melanoma, navius. They are all epithelial tumors. If you come to non-epithelial tumors, lipoma, fibroma, myxoma, chondroma, osteoma, benign synovioma, levomyoma, rhabdomyoma, liposarcoma, fibrosarcoma, myxosarcoma, chondrosarcoma, osteosarcoma, rhabdinosarcoma. These are all examples for non-epithelial cell mesenchymal tumors, and Annoazotous cancers are like this, non-epithelial tumors. If you go to a cancer hospital, they will give grading and staging of a cancer. Stage 1, 2, 3, 4. If a fourth stage is there, it is incurable, and the TNM are there. T for tumor, N for node involvement, lymph node involvement, and M for metastasis. So this is Union International Counter Cancer Geneva's guideline for TNM score, and T0, T4 or N0 up to N3, M0 up to M2. These are the normal staging and grading of cancer. Based on this, how much tumor is activated, how much node is activated, how much metastasis is there. If you understand these concepts, we are going to give better treatment in Ayurveda or modern medicine. What are the symptoms of cancer? Any rapid unexplained weight loss. Rapid weight loss, unexplained weight loss is first symptom of cancer. If anybody is having Dhatu Kshaya and there is Dhatu Nasha, the body weight loss, then that is a suspicion for cancer. Anorexia, nausea and vomiting. Who will not get this anorexia and normal vomiting sensation, nausea and vomiting sensation? Everyone will suffer. Even nowadays, 10-year-old or less than 10-year-old boys are prescribed with Rantac 150 mg or other antacids. So next is fatigue and weakness. Patient will be very weak. Weakness is one of the symptoms of cancer. Confusion, fever, dyspnea, Shwasakrutshrita, edema, Padashota, effusion, frequent infections and pain can be taken as symptoms of cancer in general. Like change in the bowel habit. That is, constipation person gets Atisara. Atisara patient gets constipation after a certain period of time. Then they should be treated on the lines of cancer. A sore or ulcer that does not heal. Non-healing ulcer is another symptom of cancer. Unusual bleeding or discharge through mouth, nose, ears and anus or genitals. This unusual bleeding, abnormal bleeding can be taken as cancer. Thickening or lump or tumor mass in any part of the body, especially in the skin, mouth or breast, is a symptom of cancer. Whenever there is a gulma, whenever there is a vrana, whenever there is mukapaka, whenever there is koshta baddhata or atisara, you can suspect cancer in a patient. Ingestion or difficulty in swallowing or painful swallowing, burning sensation during swallowing is a common symptom of cancer. Next is obvious change in the wart or mole. A mole will be suddenly changing. A small mole is there, small wart is there. If it suddenly changes, it is a symptom of cancer. Nagging of cough or hoarseness of voice. Continuous Shudrakasa, Patajakasa, and patient is having Swara Beda, Swara Sada, there you can understand cancer. In a nutshell, I can tell you what are the investigations for cancer. Number one is radiological examination, X-ray, barium enema studies, barium meal studies, CT scan guided biopsy, ultrasonography, magnetic resonance imaging. MRI scan can help you to diagnose cancer, angiography, radioisotope scans, mammography, biopsy, cytological examination like exfoliative cytology, endoscopic examination, immunodeficiency, immunobiochemistry loss, or tumor markers are present. If these investigations, if you do, you can independently diagnose a case of cancer. If you come to the treatment, there is one Sthanika Chikitsa and another is Sarvadaika Chikitsa. Sthanika Chikitsa is Sthanika Chedana, Lekana and radiation. Sarvadaika Chikitsa is chemotherapy, hormonal therapy, immunotherapy. Chemotherapy is administration of anti-malignant drugs, or withdrawing the hormones is hormonal treatment. Immunotherapy is very rarely used in case of treatment. So what are the take-home message we have talked today is, we can understand Arbuda, Gulma, Avarana, Apachi, Pandu, Rajayakshma, Dhatupaka, Shosha, Jara and Grahani. These are some important areas. If you read Lakshanas of all these diseases, or if you read the Upadrava of all these diseases, you will get a clue of cancer. In the cancer, only one answer is Rasayanas. Amalaki Rasayana, Shilajitu Rasayana, Bhallataka Rasayana, Madhusnuhi Rasayana, Punarnava Rasayana. These are 5 important Rasayanas. Along with that, Kajjali Rasayana and Makaradwaja Rasayana. They are also very effective messages for today's discussion. If you can understand all these things, we can also make your better approach in oncology or tumor science. To conclude, cancer can be treated if it is detected early. Cancer can be detected based on Ayurveda, Swata Pitta Kapha Siddhanta, Dosha Dhatu Mala Siddhanta. Cancer can be understood according to Khavai Gunya and Sroto Dushti. Cancer has got symptoms and signs. Based on symptoms and signs, we can Ayurvedically understand cancer. We have Ayurvedic anti-cancer drugs like Haridra is a very powerful anti-cancer drug. Triphala is a very good anti-cancer drug. And Brahma Dandi is one of the powerful anti-cancer drug. And Rasayana Aushadhis like Shatavari Rasayana, Yashtimadu Rasayana. And you may be amazing to know that one drug you can try, Changal Koshta. Sasura Lepa is a powerful anti-cancer drug. Musta is a very powerful anti-cancer drug. And Tamra Basma, Naga Basma, Trivanga Basma, Makaradvajavati, Swarnamalini Vasantarasa, Gugulu Tiktaka Grutam, Panchagavya Grutam. If you don't know anything, write Panchagavya Grutam. If you know everything in Ayurveda, write Panchagavya Grutam for various stages of cancer. You can give Gomutra, Haritaki, Leha for many of the Shota and Vrana Pradhana cancer patients. You can give Gomutra Haritaki. 6 grams to 12 grams of Haritaki Churna, 30 ml of Gomutra mixed with water and given early in the morning. Another issue is Gomutra Yukta Kshiram. For 2 liters of Gokshira, add 50 ml of Gomutra and ask the patient to drink within 2 hours in the morning, 6 a.m. to 8 a.m. Gomutra, Panchagavya, Gomutra Yukta Kshira, Gomutra Arka, they are all powerful anti-cancer drugs. And many of the fruits, many of the Phalavarga, Yashtimadu and Shatavari are powerful anti-cancer rasayanas. And in Shakavarga, Jivanti is a powerful anti-cancer diet. If you get Sihi Hale Balli, we call it as in Kannada, and it is very powerful anti-cancer drug. Jivanti Shakanam Sreshta. We can use that. Arogyavardhini and Kanchanara Gugulu becomes an important prescription of every Ayurvedic oncologist. If you prescribe Varnadi Kashayam, Kanchanara Gugulu and Kankayanavati, and you will get many successful cases. And Kanchanara Gugulu is very good in Gandamala, Apache and Arbuda cases. Trifala Gugulu and Kanchanara Gugulu, Kaishora Gugulu all have a definite role to play in cancer. And you can also take Another carry home message: if you prescribe Shiva Gutika and Gugulu Tiktaka Grutam, an excellent combination for various tumors in the body, malignant or non-malignant disease and non-Hodgkin's lymphoma. In all such cases, Shiva Gutika and Gugulu Tikta Grutam I use in my practice. And if you are able to give Ballataka Charam, Ballataka Lavanam, Ballataka Grutam, a wonderful anti-cancer drug is Ballataka, but precautions is if you give Pitta Prakriti person, the bleeding tendency or intravascular or intra-organ bleeding is very common. So you can also try this on Vata Kaphaja cancers. And Makaradhajavati has got a very powerful genetic level arresting of the cancer and stopping of the cancer process. I have seen wherever there is a neuroendocrine tumors, you can start early Makaradhajavati. That is also going to give you a lot of good results. And Tamra Basma alone, if you have a perfect Tamra Basma or Swarnamakshika Basma, they are also having a lot of anti-cancer action. Nanoparticles of Swarna Basma, nanoparticles of Rajata Basma, nanoparticles of Trivanga Basma, nanoparticles of Abraka Basma in various combinations. If you give, even Trigunakya Kajjali in various combinations is having anti-cancer properties. So with this, I think I have taken much of your time, and I am thankful to Dr. Dilip, Dr. Shakuntala, Dr. Geeta, and all the members of Rudra Association, RAS Association. Let all of us work together from basic understanding of cancer. We can go further to any cancer case understanding and cancer patient management. In one of my studies, Dr. Mazat and myself have worked on more than 20 patients of different cancer patients were screened. We have given before treatment Amapachana Chikitsa followed by Haritakya Churnam, and later on we have started Ballataka Rasayanam, Amrita Ballataka Rasayanam, and Atrabasti with Ballataka Gratam has shown significant reduction in the tumor. In one of the patients, before treatment, the MRI scan showed glioma, and after treatment of 45 days with Matrabasti and Amrita Ballataka Rasayanam, and patient has shown after treatment therapy course absence of glioma in the MRI scan of the brain. Like this, many patients of CA rectum are responding very well. Many patients of GI tract cancer, CA stomach patients are responding well. Even CA lungs and CA liver, metastasis in lungs and liver, they are also responding very well. So this opens a new challenge and scope for Ayurvedic practitioners to take up their Ayurvedic practice of cancer management as you are one of the profession, and without any fear, you can start your career in cancer. I wish all the best for all these 65 doctors who have joined together to learn. And for any help or any guidance, we are here to have an online discussion. Thanks for giving me an opportunity. I am very much thankful to my cancer patients, my PG scholars of Pachkitsa PG department, and oncologist from Vijayanagara Institute of Medical Science, Dr. Nehal Kumar, and also my respected teacher, Professor Gurdeep Singh Ji, and the Rasayana I learned by my co-guide, Dr. Srinivas Hejmadi Acharya Ji, and also my Guru Nam Guru, Dr. Srikant Bhagavadikar Ji, for making me to understand some concepts in cancer and giving me the knowledge and their guidance again and again. I'm thankful to you. Thank you, one and all.
Thank you, sir. It was very wonderful presentation, sir. Really, we are very glad to hear your lecture, sir. Now, a small note to all the delegates that to ask only topic related questions one by one in chat box. Sir will answer one by one. Okay, sir. Shall I read for you?
Okay. Yes. Yes. One question was there: how to manage leukemia? See, there are two major issues of acute myeloid leukemia and chronic myeloid leukemia. In leukemia, hemopoietic system is affected. So, Swarnamakshika Basma and Hiraka Basma Rasayanas and Basti Kalpas, if you give Pancha Gavya Gruta Basti or Gugulu Tiktagrita Basti. Along with that, if you give Swarnamakshika Rasayanam and Shataputi Loha Basmam and Hiraka Basmam, patient will respond.
Okay. Here, one more question. Dr. Rajeshwari is asking, use of large quantity of Kshira in treatment. How is it helping in cervical carcinoma management and also Dushi Visha in causing carcinoma?
What happens is cancer patients die because of two things. One is by pain, another is by starvation, lack of nutrition. So Kshira is Amrita. If Gokshira is given as an Amrita, actually milk gives you very good nutrition to cancer patients. So that's why if you give Kshira for patients of cancer, the cell will be coated with milk. Due to that, patient's cell will not die. Nutrition will be given to cells and patient will not die. And as far as cancer related to cervical cancer, it spreads to breast very fastly. So CA cervix will go to the breast cancer. So in that case, you can use a rasayana which is going to prevent the spread first. Surgically remove the cervical area, hysterectomy can be done, followed by Ayurvedic chemotherapy can be given. So Hiraka, Kajjali, Tamravasma and Swarnabhasma, they play a vital role to heal such CA cervix patients. Thank you.
Thank you, sir. Shiva Gutika doses, sir.
Shiva Gutika, it can be given 1 tablet 2 times a day. 1 tablet contains 12 grams of weight. You can give 2 times a day. So it is a big tablet. So break the tablet and take with Madhu as Anupan.
Okay. Dr. Anand sir asking how to identify in the initial stages of cancer and initial preventive aspects of Ayurveda.
Yes, initially, it's a very good question. Ayurvedic role is much here. We have to do routine cancer screening programs, breast screening programs. Cancer markers are there, CEA, CA 19.9. These markers can be studied, and prostate specific antigen is there. So many tumor markers are available. And you remember, whenever CD4, CD8 count goes down, immunity goes down, cancer will develop. So you assess the immunity of a patient and tumor markers, routine ultrasound scanning, routine blood counts, TCDC, ESR, and along with that, if you can do some tumor marker studies in high risk group, you can locate the cancer patient. And the best approach is you give Vasantika Vamana, Sharadika Virechana, Varsha Rutu Basti, followed by Haritaki Rasayana in Shadrutus, Sindhutta Sharkara Shanti, Kana Madhu Udai Karma. If you give 5 Amalaki in one lunch, you can prevent cancer. If you give Amalaki Rasayana throughout the year, if you give Abhayamalaki Rasayana, if you give Amrita Prashavaleham, if you give Ballataka Rasayanam throughout the year, for cancer risk patients, cancer can be prevented. Cancer prevention is rather than, it's the only priority of Ayurveda science. Allopathy system cannot prevent cancer. They can treat once cancer comes, they will start their work. But cancer prevention is in the hands of cancer screening programs, mass screening programs. After 40 years, everyone must be screened for cancer. Then we can detect and prevent. And Rasayana is the only way, Shodhana and Rasayana, Rutu Shodhana and Rutu Rasayana, if you give, definitely we can prevent cancer patients.
One next question, sir. Dr. Madhuri is asking, is there any limitation of Ayurvedic management in case of malignant tumors at any stage, sir? Any contraindications of particular medicines, sir?
Yes, what is Ayurvedic limitation is, you should do work with integration. You should work with an oncologist. One oncologist, one general physician, and one Ayurvedic doctor. If these 3 people joined together can make very good Ayurvedic treatment for patient. Because anytime modern investigations and modern referral is needed, you should take second opinion of a modern doctor. When tumor is in last stage, patient is having multi-organ metastasis and metastasis in the brain, spine and lungs. patient is having chances of death. So in that time, alone Ayurvedic doctor cannot handle. A integrated team must be there that can give very good support to the patient. This is as far as limitation is concerned. Side effects concerned, see, side effects are there from paracetamol to any drug. So Ayurvedic drugs are also having side effect if not properly manufactured. If manufacturing process has got a shortcut, any Kashtaushadhi or Rasaushadhi can have side effect. Otherwise, there is no side effect with Ayurvedic drugs. Amalaki is not having any side effect, and turmeric is not having any side effect, right? Herbal drugs are not having any side effect. Amalaki Rasayanam is not having any side effect. When it comes to the question of Rasaushadhis, you should depend on a very good Rasashastra manufacturing person. If that person is really manufacturing with all Ayurvedic and Rasashastra concepts, no side effects are there. I have not seen any side effect in treating cancer patients. In 22 years, I have not seen any undue results of or unwanted effects, adverse effects of Ayurvedic drugs, because we have to choose very carefully. Thank you.
Sir, how to manage leukemia?
Leukemia is, if you are able to manage WBC count and RBC count, if you are able to improve the bone marrow improvement is very important concept in leukemia. Bone marrow can be manufactured by Vrutakalpas. You have to do one Nasya karma is there. Stem cell Nasya can be done. If you get any umbilical cord of a patient of the same person is told that umbilical cord of Vruta is very good for leukemia. Swarnamakshika kalpas are very good for leukemia. Loha kalpas are also very good for leukemia. Palatrikadi kashayam is also good for leukemia. Drakshavaliham, Drakshadighrutam, Dadimadighrutam are very good. I am noticing Dadimadighrutam is very effective for hemopoietic system cancers. But if WBC count doesn't come back to normal, or if platelet count goes down, patient starts bleeding. So that's why you should be careful in handling them.
Okay. Dr. Hemalata asking, we need one more session, sir. Yes, Dr. Hemalata, we will also expect more sessions from the sir.
No problem.
Yes, sir. And sir, how to treat brain tumors? Whether the medications we give can pass through blood-brain barrier?
Definitely. Ayurveda drugs have got more chance to cross blood-brain barrier. Any of your Rasaushadhis will, especially Rajata Bhasma crosses blood-brain barrier very fastly. Rajata compounds are very good. Second is brain tumor, depending upon the size and depending upon the complications, we can treat them. If the size is in our control, we can treat them. Otherwise, no problem. But our Shilajitu, Rajata Bhasma, Swarnamakshika Bhasma, all of even Tamra Bhasma, Haratala Bhasma. Haratala is a powerful drug to enter into the tumor cell. So don't worry about blood-brain barrier. They will cross. So Ayurvedic line of treatment should be adopted. Don't run behind a drug-based approach. You don't think that Hirakavasma is the best rasayana for cancer. Don't go to the. That's why I said in the initial talk that dosha dusha sammurchana, samprapti, if you make properly, shodhana followed by rasayana, anta parimarjana chikitsa and bahi parimarjana chikitsa, if you make a total program, you can succeed. If you think only one herbal drug or one rasaushadhi will be effective in cancer, risks are more or chances of failure is more.
Okay. Can we give Rasayana in diabetic patients?
Sure. Diabetes patients can be treated with rasayanas without any problem.
Sir, how you can understand cancer with related to dosha concept?
Definitely very good. You see, that's what I'm telling. Forget modern science when patient comes in front of you. You check dosha dhatu mala vruddhikshaya lakshanas, srotas lakshanas, avarana lakshanas, vruddhikshaya lakshanas, ama lakshanas, sroto rodaha, balabramshaha, gaurava, anila mudata. This ama lakshana can be seen in every patient of cancer. Dhatugata amas, avaranas, gulma, kshaya, anuloma kshaya, pratiloma kshaya. Like this, you have so many protocols for diagnosing Ayurvedically. Then take modern investigations help and diagnose the patient. And don't leave Kriya Kala. If patient comes in Kriya Kala, Asadhyavastha or in Upadravavastha, patient is dying, and if they bring to you, Rasayana Chikitsa will not help. Even then, Rasayana Chikitsa is told, Yavat Kantagataha Prane Tavat Chikitsa Kuryat. Charaka says like this. So, Kantashrita Prana is there, you can treat, but success rate will be less. So, you give awareness to the patient. Patient will lose money, patient will lose hopes, patient will lose the mindset, depression, and then they come to Ayurveda and they will ask, sir, don't prescribe costly medicine, you give some free medicine or cheap medicine. This is not the way to treat cancer. They have spent 10 lakhs or 20 lakhs in modern hospital and they are unable to purchase Trifla Churna also. Then what to treat? Addo Rogi, Bishakoshaha, Napaka Sattva. So the stage of the patient, the condition of the patient, the prana, if the prana shakti is present, Aisha Bala Pramana Pariksha, Prana Pariksha, Pranayatana Pariksha, Trimarma Pariksha, you should check all these things. And even astrologically also you can diagnose the chances of life of the patient and then treat. And if patient says, I am unable to purchase Google Tikta Grutam, then what is the fun in treating them? Understand? So the modern people will exploit totally and they have taken a lot of money. And patient comes on the deathbed and the Ayurvedic doctor cannot do magic. We cannot do jadoo. I don't believe in doing jadoo. If patient is sadhya, sukhasadhya, putra sadhya, yapya, pratyakshaya, that's why Samhita says, yo sadhya sadhya vibhagagnaha sachikitsakaha. First of all, you should know which is sadhya and asadhya. You treat sadhya patient. You treat kashta sadhya patient. Pratyakshaya patient and asadhya patient are only coming to your clinic means all will not improve. So you should explain the prognosis to the patient. Even allopathy doctor will tell, I am doing a trial. I will give 20 chemos and 20 radiotherapies and we will try. People are ready to try with 5 lakh package, but people are not ready to give 200 rupees to Ayurvedic doctor. Then there is no fun in treating.
Your view on vaccination and its relation on Arbuda.
See, cervical cancer has got a vaccination now. Many lady doctors are putting that, and many cancer preventing vaccines are under trial, and still it is very early to comment any thing on that. I have no much experience that who have taken cervical cancer vaccine and they have not developed cervical cancer when her mother is having cervical cancer history. I have not received any such patient. I don't have experience on that, but vaccination is one trial. We can do trial and error, no? They are doing all trials. Chemo is a trial, radiotherapy is a trial, surgery is a trial, and vaccination is also a trial. I have not good experience on that.
Okay, next question. I think it is incomplete. After chemotherapy, management, radiotherapy.
See, modern people will do 2-3 fashion. One is surgery followed by chemotherapy, radiotherapy. Other is no surgery, directly chemotherapy, radiotherapy. Another is directly they start radiotherapy and then give chemotherapy. Now immunotherapy, target therapy, biological therapies, these therapies are increasing in number. So these are all trials. They do trial. They will tell and do the trial. See, I'll try. If you improve in 5 sittings, we will continue. Otherwise, we will not. Listen.
In 45 years, male brain tumor patients, if prolactin levels is 120, what is the treatment?
This is hyperprolactinoma. Prolactinoma. Brain tumor is due to the hyperprolactinemia. So one is you should do Granthi Bedanam, anti-tumor, Rasayanam, and prolactin decreasing line of treatment. So for that, you have to do Sarvadahika Shodhana, and Kuti Praveshika Rasayana is very good. Especially Shilajitu Rasayana, Trifala Rasayana, Rajata Rasayana, and even you can also try Abraka Basma Rasayana. Abraka Basma, Sahasrapati Abraka Basma has got good action on that. For hyperprolactinemia, if you give Vairechanika Nasyam, that prolactin level will come down. Once prolactin level comes down, you can treat brain tumor alone.
Sir, could you please tell me whether there is any prominent role of Agni Karma in Arbuda as Agni Karma in reoccurrence?
Very good. See, in case of benign tumors, Agni Karma is very powerful line of treatment for benign tumors. But for malignant tumors, we can stop bleeding or we can stop quota. There is a immediately chances of development of gangrene, immediately chances of development of ischemia. In that, peripherally we can do Agni Karma and treat. Another role of Agni Karma in cancer, what I feel is the pain management. When patient is having a pain due to the tumor, then we can try Agni Karma. Otherwise, tumor, once we do Agni Karma, recurrence is not there, we cannot tell that. So many tumors reoccur after Agni Karma also.
In a patient,
Pain relief is very good.
sorry. In a patient, a cyst growing in bladder, surgically removed. Neoplasm in the bladder is the report. Slow growing neoplasm is report after removal of cyst. Age 70 years. No other symptoms. How to manage?
It can be treated, no? You can give Uttaravasti of Vastyamaya Ghritam locally, and internally anti-cancer chemotherapy can be given. It is a combination of, you can try with Trivanga Basma, Kiraka Basma, Swarnamakshika Basma. These three basic Ayurvedic anti-cancer drugs can be tried. Along with that, you can treat symptomatically, and even Chandraprabhavati is also going to stop further intrabladder neoplasm.
Is Agni Karma prevent reoccurrence?
Chances are there. Agni Karma can be tried. If it is a peripheral tumor, the chances of tumor recurrence is also can be reduced. That's a good idea.
What prophylactic agents can be used to prevent CA?
That is, it's not a single point answer. We have to find out which type of cancer we want to prevent. We want to also try to know the patient condition, and also we want to know the tumor markers level, and then we can try prophylactic rasayanas. Definitely we can try. No problem.
Sir, your opinion on role of Arogyavardhini Rasa in cancer patients?
Definitely, Arogyavardhini is a wonderful rasayana for prevention, prophylaxis, and treatment of many cancers. It can be tried. Definitely works.
14 years girl diagnosed as bone marrow cancer. How to treat?
That is Asti Majjagata Vatam, Asti Majjakshayam, Majja Balyam, Brahmanam, Snehanam, Vastihi, and Rasayanam. This is the best line of treatment for them.
Sir, please explain role of Basti and medicines used. And
that is a tailor-made approach. Whether to give Ksharabasti, whether to give Kshirabasti, whether to give Madhutailika Basti, or I use Pancha Prasrutiki Basti. These Prasrutiki Basti, Baladi Bastis are very good, Yapana Bastis are good. That depends upon my Samprapti. What I want. Mustadi Rajayapana Basti is a very helpful treatment for any of the cancers in bladder, cancers in Mutravasrotas. So Basti is a definite line of treatment because cell metabolism, cell mutation, cell uncontrolled cell production, they are all Vayus Tantra Yantradaraha. Cancer is Vata Pradhana Tridoshaja Sannipataja Vyadhi, and in Vata Pradhana Tridoshaja Vyadhi, Basti is the best line of treatment. We can depend on Basti, no doubt.
Treatment for osteosarcoma.
Osteosarcoma I have treated. I remember. This is Sagrita Kshira Basti we have tried. Stanika Lepa followed by Sagrita Kshira Basti. It has helped very good in osteosarcoma.
Can a cancer patient take COVID vaccine?
Yes, definitely they can take. What is there? They can take.
Which pharmaceutical company medicines you usually prescribe for your patients?
I have used all companies. I have tried in 22 years. I know that all branded company products are not good. All Chota company products are not bad. I have to do a trial and error basis and to find out every company has one or two good products. I have to choose them. Every company has got one or two products are good. You should choose them, try them. If result comes, continue. Otherwise, stop it.
Ayurvedic pain management in CA.
Ayurvedic pain management is a big drawback. We don't have very strong pain management schedule. We try from Agni Karma, Basti Karma, Lepa Karma, and Sthanika Dharvas, Sthanika Bastis. So many things we do, but still we are not 100% sure shot in some time. Why it happens, I'll tell you. For modern people, narcotic drugs are allowed, like ahifena kalpas, bhang kalpas are allowed. But for Ayurvedic doctors, bhang kalpas and ahifena kalpas are banned. Ayurvedic companies will not manufacture ahifena kalpas and bhang kalpas. This cannabis sativa is there, no? If I get a permission from government to use bhang as one of the anti-cancer pain management drug, definitely we have a role to play. This is the hypocrisy. Our friends are allowed to use morphine pethidine injections and morphine tablets, but for us, ahifena is banned. So how can we treat pain management in cancer? Pain is the only important aspect of cancer management in many patients. So cannabis containing drugs are powerful in controlling pain. Powerful. They are very powerful. In one of the study recently, Dr. Ravi Narayan Acharya from Gujarat Ayurveda University, Jamnagar, they have tried pain management by cannabis preparation. It is found effective in case of cancer pain. Otherwise, we have to do a lot of trial and errors. Patient may get success or may not get success, but these drugs have got the success. So we should fight for our right to use narcotic drugs in Ayurveda.
Can you please mention a goodbye pharmacy for Rasaushadis and Basmas?
Not one pharmacy is not like that. I like one pharmacy is Trivanga Basma. I like another pharmacy is Aragavardhani. I like another pharmacy is. The best pharmacy is your own pharmacy. The final is your own preparation. For time being, you can use any pharmacy's medicine. You will understand its good or bad effects.
Sir, dosage of different Basmas.
No, that is not standardized and fixed. It is tailor-made. From 30 milligram to 60 milligram or 1 rati, we can give basmas.
Integrated approach is good or can be treated with only Ayurveda medicine in early stage of cancer.
No. I don't believe in this. Integration is not Ayurvedic doctor giving a allopathy injection. Integration is a system integration. Multiple specialists should sit together and that should be practiced with integrated approach. My integration is this. One cancer diagnostic person, cancer surgical person, chemo radio giving person, and then Ayurvedic person and one general medicine person. Like this, a team of doctors doing is integration. Not Ayurvedic person giving paracetamol is not integration.
Namaste, sir. Can you tell something about Rutu Rasayana?
Using of Haritaki in 6 Rutus. Sindhukta, Sharkara, Shunti, Kana, Madhu, Gudaihi, Kramat. In every season, first season with Saindava and Shunti, Sharkara and Shunti, Pippali and Shunti, like that we will use.
Okay, thank you.
Thank you, sir. Thanks for wonderful presentation and so patiently answering so many questions. Now I request Dr. Dilip sir to give vote of thanks.
Good evening to one and all. Thank you, madam. Thank you, sir. Very good evening to one and all. One slogan is there: a good teacher will only teach us the lesson. A better teacher will teach us with examples. A best teacher will only inspire us. Okay. Today we have a fortunate to have such a good, better, and a best teacher with us. So he is a renowned identity in academics and a stalwart of Ayurveda, Dr. Madhav Digavai, sir. I am very much thankful to you, sir, on behalf of RAS Group and RAS team, all admins for enlightening us towards a cancer and cancer treatment in very simple way, in a very simple classical way, how we can diagnose, how we can teach, what are the rasayanas, very simple drugs we can use in day-to-day practice and all those things. And sir is like an open book. You won't hide, I won't hide anything. I have seen sir from 2003 till 2022. So sir is not at all hiding any single drug or any single medicine. Sir is a great inspire for Ayurveda and great inspiration for us also. And thank you very much, sir, for participating in our webinar. and we will call you once again, sir, for webinars. Thank you for enlightening us towards cancer. Today, all of you got some light towards cancer. Definitely, we will go on your steps and we will practice cancer, and we will make a big hub in cancer in Bangalore. Definitely, we'll invite you, sir, for the inauguration. Thank you very much. Thank you very much, sir, and thank you very much for all the participants who have participated and you listened patiently. Those who are asking the question also, sir has answered very patiently to all the questions. Thank you very much for everyone. Thank you, one and all.
Thank you, sir. Thank you, Dilip.
Thank you so much, sir. Once again, Geeta. Thank you so much, sir. It is very wonderful session, sir, actually. And we need actually more sessions like this. We want more sessions, sir.
We'll call you very soon, sir.
Very good. Thank you.
Thank you so much, sir. We'll wind up now.
Yes, definitely.
Thank you, one and all.
नमामि धन्वन्तरिमादिदेवम् सुरासुरैर्वन्दितपादपद्मम् लोके जरारुक्भयमृत्युनाशम् धातारमीशं विविधौषधीनाम्